lot of us visit chiropractors for aches and pains or to prevent an injury, but what about toddlers and babies? Would you send yours to a chiropractor?
You can weigh in on the Vote Now tile of the WFAA app, and heads up, you know the sound of a back popping? When a baby's involved, it might make you cringe. Here's health and wellness reporter Sonia Azad in tonight's WFAA Original.
Wiggly.
At just 11 months, Piper is getting a chiropractic adjustment.
We just come once a week and it keeps her pretty regular.
And if you listen closely, you can hear it.
1, 2, 3, jump.
It's not her first time. This is part of a routine to address Piper's digestive struggles.
I do think that helped with her stomach, with being able to release the gas in her stomach.
More parents are getting comfortable with this idea.
We're very open to more of the holistic.
We come once a week.
At True Light Chiropractic in Salina, Texas,
You want to get adjusted?
about half of the patient population is kids and babies.
We always suggest to get the baby in as soon as possible.
Chiropractic doctor duo Colton Wood and wife Kelsey use activators and pediatric toggle headpieces to provide quick and specific adjustments on these tiny spines.
All right, you ready?
Oftentimes, it's the mom's intuition that brings them in. And it's oftentimes the husband or the dad who is like, oh, it's like a pediatric massage, like what are they gonna do? And we hear that all the time. And then just throughout care, they start to see the results and it starts to speak for itself.
Oh, you're so good.
Backed by the International Chiropractic Pediatric Association, the husband and wife team are Webster certified, which is a pregnancy-specific technique.
1, 2, 3. Jump.
So a lot of it is still cartilage. It's not necessarily even bones like people would think. So what we're actually doing is we're holding pressure points on the babies, and we like to describe it as like if you were to hold your finger on a stick of butter and wait for it to melt, then that would be the same exact thing that we're feeling under our hands.
The big three conditions that draw parents to pediatric chiropractors are colic, acid reflux, and ear infections.
Our daughters had a lot of trouble with ear infections, so that was kind of our biggest reason for getting her in.
But does it work? Amy, who brings all 4 of her kids in every week,
Let's start with your neck.
says yes.
I reached out to a couple of children's hospitals in Dallas and pediatricians and orthopedic surgeons. None of them wanted to touch this topic. Here's what the American Academy of Pediatrics says. Evidence is lacking when it comes to chiropractic care, especially with infants and children. The AAP goes on to say the risk of adverse events may be the highest because of immature stability of the spine, that serious complications are possible but rare.
So we're doing his neck first.
Tell that to Dad Troy Sebo.
First adjustment was 2 hours after he was born. And we chose to do this because as the babies are delivered, they're having to be contorted in different ways, and there's a lot of stress that's put on the spinal column and the nervous system.
Relieving stress around the spine signals the body to return to a more calm, resting state, a departure from that flight or fight mode. Wood says that opens doors for healing, adapting, and growth. Parents just know there's something about this that keeps their families and thousands more coming back.
Seems like the grander population is starting to look into more natural ways of healing and adapting and looking into health that way. And so we're very excited to be on the forefront of that.
In Salina, I'm Sonia Azad.
Okay, so now some of those loud noises you heard was actually a piece of wood on the device they use for adjustments, FYI.
Yeah, as you might imagine, the American Chiropractic Association supports chiropractic care for children. You heard Sonia mention the American Academy of Pediatrics. They actually have a 23-page report on alternative therapies, including chiropractic, and we posted that complete report on WFAA.com.
As for the question we asked, would you take your baby to the chiropractor? Okay, the majority of you, 74% of you say no, while 26% say yes, you would. Hey, thanks for being honest and voting tonight.